How's it going? My name's Jack. I'm a doctor of physical therapy student here at RMU. Today we are dealing with Ronnie, who actually sprained his right ankle 2 days ago, so we're kind of in that inflammatory stage of healing. So our plan today is to use some ultrasound on him. Since we are in that inflammatory stage of healing, we're going to be using a non-thermal DC current, just so we don't have any thermal effect, just because we already have some inflammation in the area. We are going to do a 5-minute treatment, just some indications of using ultrasound. We have some pain, some inflammation. We want to promote some protein synthesis, increase calcium ion flux and tissue regeneration. And we also want to stimulate an increase in fibroblastic activity and cell permeability so we can kind of ramp up that healing of his sprained ankle. Before using an ultrasound, you do want to be aware of some contraindications, such as spinal cord stimulators, some carotid bodies in arteries, phrenic nerve stimulators, any implanted devices surrounding the body. You want to try to avoid using ultrasound on any patients with those. Some absolute contraindications where you definitely do not use ultrasound is pregnancy with history of miscarriages, any active deep vein thrombosis, active cancers, or impaired cognition. So with that being said, we are going to head over to Ronnie and we're going to get the ultrasound set up for him. So we're back here with Ronnie. We have him all set up with a pillow kind of behind his shoulders, draped underneath with a pillow underneath his knees. How's your ankle feeling, Ronnie?
It's not feeling great. It's hurting pretty bad, and there's some inflammation.
Okay. So hopefully this ultrasound makes it feel a little better. I know that the area is a little tender to the touch, so I'm going to actually palpate the area with about as much pressure as the ultrasound would be applying. I want you to let me know if it's bearable or not, okay? We're on that lateral ankle, kind of lateral malleolus. Awesome. Does that feel okay? Not too bad? Awesome. Are you okay with trying out ultrasound today? Great. Awesome. So we are going to get the machine all set up here for Ronnie's treatment. We're going to aim for about 5 to 8 minutes of ultrasound treatment. Initially, you want to click the sound combo, making sure just the sound is on. Having the ankle sprain not be too deep underneath the subcutaneous tissue. We are going to want a longer frequency or larger frequency, so we're not traveling too deep into the tissue. And then we are going to put it on 10% of CD, so we're not having a thermal effect. And then we go up to intensity, and we're going to go up to 1.5. We're going to add the ultrasound gel to the area of injury, place the probe onto the area, and then we're going to press start and start this treatment. Awesome. So Ronnie, this gel is going to be a little cold, okay? Just a heads up. If you get any pain, discomfort at any point, please let me know. We can go ahead and adjust everything. I can adjust my movement of the probe itself, and it should feel better. So now we're going to press start on the machine, get the probe on there, and then we're pressing start. And again, we're utilizing sound waves to kind of promote healing processes here. And you just slowly move around the area of the injury, not applying too much pressure. How's everything feeling, Ronnie? Good. So we're going to aim for about 5 to 8 minutes of treatment in order to get max benefits or effects from the ultrasound.
Feel great. Awesome.
Feeling okay still?
Good. You want to make sure to keep the probe moving, not letting it sit in one location for too long. Constantly checking up with your patient is a good idea too, making sure that they're feeling the effects or they're not feeling it too much.
It's been 8 minutes or 10 minutes.
How's it going, Ronnie? Feeling pretty good?
Yeah.
Awesome. So we'll do a couple more seconds here.
1 second while I just wipe the skin.
Good. Now after about 5 to 8 minutes of treatment, we're going to take,
Looking good. How are you feeling?
turn off the machine, and then we can take the probe off once we are done to ensure we do not damage the crystal. And after treatment, You just want to observe the skin, make sure there's no abrasions, bruising. You could also grab a rag and kind of wipe off that excess gel so your patients will like you. How are we feeling, Ronnie? Still okay? Feeling a little better than before?
Definitely.
Great, awesome. And that's how you use ultrasound.